So having the ability for them to mask so that there's reduced spread in that setting is important. But what we know from CDC guidance is that mask on mask, if you have an individual who is infected in the school system, a student, and they are masked and they are exposing another student who is masked, we are not looking at sending an entire classroom home. We're looking at sending that one child home. So one of the main things we want to be focused on is our children being able to stay in school as much as possible. And having masks worn in the school is going to increase the likelihood that children are not going to have to be sent home to quarantine because they've potentially been exposed. So that's been our recommendation to the school superintendent and to the school staff. And I know they'll be making their own recommendation to the school board tomorrow.
Next question is Chloe Leshner, WCNC.
Hi, Gibbie. Are there any metrics you're specifically looking at, any points where we would reach that you would then change to recommending a mask mandate? Thanks.
Thanks for that question, Chloe. We are not looking at specific mandates specific metrics at this point around that. I think what we're looking at is the trajectory of cases in the county. We are seeing those numbers go up significantly. We're also looking to other countries that are ahead of us and what's happened in those places as a way of thinking about what may happen in the United States. So not specific metrics at this point. We don't have a threshold at what point we may, but as we're continuing to watch over the next couple of weeks, if our numbers continue to escalate at the level that they're escalating, we'll be having more and more conversations with the leaders in our community around what we might need to do.
Next question is Claire Donnelly, WFAE.
Hi, Claire Donnelly, WFAE. I actually wanted to ask about breakthrough cases again. Has there been any update from the state on collecting that data? And why can't the county say how many breakthrough cases have been here? I don't understand the breakdown between the state and the county there.
I'm going to ask Dr. Washington if he'd like to respond to that question.
Sure, yeah. So first off, there are two different systems that manage information around positive cases and individuals who've been vaccinated. And currently in Mecklenburg County, we have created a very manual process by where we're able to track breakthrough cases that are self-reported to us. When we talk to people during case investigation interviews, those two systems don't actually speak with each other, and we don't have access to the back end of the vaccination system data. So we can't just click a button, run a report, or write a script to run a report to be able to compare the two lists to say this person was reported as a positive case and they also were vaccinated previously. So right now we don't have the capacity here locally to do that. We do have, again, we are tracking self-reported cases of individuals being fully vaccinated and also becoming infected. And that process is manual, and so it's just taking us more time to be able to share more information about those individuals.
And then do you have the numbers yet at the county level for breakthroughs?
We do expect to have an estimate included in the data release on Friday, and our team is working as quickly as possible. I know we've gotten a number of questions from you all about this over the course of the last several days, and so we're going to have as much detail as we can provide. We'll include in the data release that's coming out Friday morning.
Next question is Alison Kuznitz, Charlotte Observer.
Hi, Gibbie. Can you talk about other restrictions that are being considered locally as far as maybe limits on indoor dining or capacity restrictions? And can you also talk about now public health employees are required to get vaccinated? Can you talk more about that decision and why it does not extend to all county employees just yet, and if it will extend to county employees later?
Thanks, Allison. Yes, we have not had conversations about any other restrictions at this point. Again, we're focused mainly on vaccinations and masking. If we can really focus on those two issues and make some some headway around those two preventive measures, we really believe that we can make a difference in terms of the cases that we're seeing in Mecklenburg County. So we're really focused on that right now. In terms of the vaccination mandate for the Public Health Department, we have a number of vaccines that we require of our staff because of the type work they do. Of course, that includes flu, but it also includes measles, mumps, rubella, and several other vaccines that if someone were to be infected could create a challenge and exposure for the clients that we see in our community. So it is not unusual for public health to require some vaccines. The decision to add COVID to that is that, number one, we're seeing increasing cases in our community, and we want to make sure that we are not contributing to that through our staff. So we are mandating it for our staff. We're adding it to our list of vaccines we already mandate. The county does not mandate any vaccines at this point, and I do not know. That's a decision that the county manager will need to make. And so I can't speak for her at this point.
Next question is HSaenz, WCNC.
Hey there, Gibbie. So a lot of business owners here in Mecklenburg County, some of them have already gone back to requiring masks indoors since this guidance came out. Others, of course, have not. If they are watching you tonight, what is your message to business owners? I know that you don't have a mandate in place for inside, but what would you tell business owners to do today?
Hunter, what we would ask is that our business owners require individuals to wear masks when they come into their businesses. It is a way of protecting their own employees so that they can keep their businesses open, but it's also a way of protecting their patrons and the community at large. So the ask is, and based on the CDC guidance, that individuals indoors are wearing masks at this point, regardless of vaccination status.
Next question goes to Kari Beal, Spectrum News.
Hello, thank you for having me. I have a question about the breakthrough cases. There's been some information coming out about the Pfizer vaccine, and the CEO says he does believe that people will need to get a booster eventually. So I was wondering with the breakthrough cases, if you know if any more of them have been people vaccinated with Pfizer versus other vaccines. And another question I have is if people should get an antibody test to know how well they are protected right now.
Dr. Washington?
Sure, yeah. So on the first question, we certainly are, we don't have a strong enough sample of breakthrough cases that we could validly be able to tell you the proportion of those that had each of the vaccines. There is data that's come out and that was connected to the report yesterday that definitely showed that the Pfizer and Moderna vaccines were showing to be somewhat more effective with the Delta variant compared to the Johnson & Johnson as it relates to having breakthrough cases. But the reality is that we're going to work as quickly as we can, and we continue to work with the state to ask them to be able to actually provide a more robust analysis so that we can have that information available for you all as soon as we possibly can. Like I said, we're working towards having some information about breakthrough cases in our report on Friday, and it won't be as robust as we probably would like it to be, but we are working to get to that point at some point in this process. The second part of your question was related to, can you repeat it for me?
Yeah, about an antibody test. So if you're wondering right now how strong the vaccine is still operating in your system.
Yeah, so we're not encouraging residents to go out and get antibody tests. Most of the common point of care antibody tests won't actually tell you the level of antibody activity you have. It's a cut point, so it tells you at a threshold, but it doesn't give you an exact level of activity. We do know that there are some trials going on in our community where they are looking at, and we know all of the manufacturers have ongoing studies to look at the level of antibody response or immune response in all those individuals who have been vaccinated and are part of those trials. But we're not currently recommending that as a to-do for individuals. And there's also some some questions about the exact correlation of what the results of the antibody test tell you and if the threshold levels, what they mean in terms of reality. So we don't think that information is incredibly useful for the average citizen at this point.
Thank you.
Next question goes to Katie Soloff, Axios Charlotte.
Good afternoon. So Gibbie, I know that you were saying that you're not going to outright support a mask mandate at this time, and that you'd like to think that our community will step up and do what is necessary. I don't mean to sound cynical, but what makes you think that our community is going to step up and do what's necessary right now? That hasn't been the case before, both as it relates to masks and vaccination. So I'm just wondering if something has changed.
No, nothing has changed at this point. And, you know, the guidance just came out yesterday. So we're still having conversations about what the county might be willing to do. I know the city's having conversations. I've had several emails from the towns today about this. So there's a lot of discussion going on right now around this. In the meantime, while we're making decisions about whether we stick with recommendations and mandates versus mandates, we are just asking people to step up and do the right thing. We've been asking that all along, and just will continue to ask that of our community. It's the right thing for people to do. The other thing that we do know is the governor has a press conference tomorrow afternoon. We don't know what he's going to say, what changes he's going to make in any guidance he will come out with based versus what he said at his last press conference. So again, we don't want to get too far ahead of things, and we want to make sure that we're being thoughtful about decisions around this. So in the meantime, we are just asking the community to step up and put those masks back on for a while longer. I think, unfortunately, that is where we are in what we're seeing, and just understanding that the majority of our cases are in younger people. We just need them to do the right thing. And so we'll continue to ask for that.
Joe Bruno has a follow-up question.
So as we've been hearing for several weeks now, nearly every person in the hospital with COVID is not fully vaccinated. Those who do have breakthrough cases are usually asymptomatic or have incredibly mild symptoms. Vaccines have been widely available and as easy to get as candy for months now. Why is the burden on vaccinated people to put on the masks yet again?
Joe, that's a great question. And I know it's a question that a lot of people are asking themselves. You know, I bothered to get vaccinated, and now you're telling me I have to put a mask back on. But you all know as well as we do that the data, the research, the science around COVID has constantly been changing since the beginning of this virus. And what we are beginning to understand is that individuals who are fully vaccinated and have breakthrough, number one, are having milder cases, some even asymptomatic, avoiding hospitalizations and deaths at the level of people who are unvaccinated. So the vaccines are working in that perspective. Now, what we have learned fairly recently, and what the CDC talked about yesterday, is those individuals, if they have a breakthrough case, have the potential to be infectious. So even though they are having milder symptoms or no symptoms at all, they may still be spreading the virus. And so that's one of the main reasons we're asking them to wear a mask, is so they are not spreading virus to other people if they might be infectious. But the other side of that is we're seeing breakthrough cases. So they're going into locations where people who are unvaccinated aren't wearing masks, and potentially exposing them. So again, this is back to the discussion we had early on around masks, is why wear masks. You put on a mask to protect yourself, you put on a mask to protect others. And that's where we are again with this virus. Unfortunately, with the amount of virus we still have in our community, the ability for this thing to mutate more is out there. So it's just critical for us to try to get this under control.
So, but why, again, the burden is falling back on the vaccinated people to mask up and make all these sacrifices when there's so many people who are just choosing to not get vaccinated. Is that fair to the people who have done the right thing and went and got a shot?
Unfortunately, it's not a matter of fairness. My mother always said life is not fair. We have people who are not being vaccinated for a number of reasons. Number one, some of that population that's not vaccinated can't be vaccinated right now, either because of medical conditions or because they're too young. We have a responsibility to protect them. Then we have others who are hesitant, who are just afraid of the vaccine for whatever reason. We're continuing to try to work with them to get them vaccinated and to help them feel comfortable enough to get vaccinated. And this vaccine is no different than any other vaccine. We have had vaccine resistance forever. There are individuals who resist any vaccine and don't believe in any vaccine. And to think that because it's COVID, it's going to change their minds, I think we're just going to continue to have some parts of our population that are not vaccinated. And I don't ever believe that we are going to see a mass mandate in this country for people to be vaccinated. So because of all of those things, we have to do what we can to protect the community. And right now, encouraging vaccination and masking are the options that we have available to us.
Alison Kuznitz has a follow-up question.
Hey, Dr. Washington, could you talk about the latest data the county has collected on the Delta variant? How many additional cases are you seeing with the Delta variant? If you can get into the percentage, how many tests have been sent to the UNC Charlotte lab? And can you talk about, I know you talked about a shelter previously, what other types of places or individuals have had tests sent to that lab for sequencing?
Yeah, so Alison, the process is I don't actually have an updated report from the local surveillance activities. I can tell you that the latest that we've heard from NCDHHS that has a surveillance system across the state, that more than 70% of the cases in the state have been identified to be the Delta variant. The specimens that are being sent to UNC Charlotte at this time for sequencing, there was a delay, I think 2 weeks ago, and so they're playing catch up now. But I will tell you that those are coming from community testing sites that are operated by StarMed Healthcare. So it really is a random sample of 200 of those samples that are coming from those sites on a weekly basis. And so as those data are made available, we will be sharing more details about it so that folks can have an understanding of what's happening here locally. And again, they're not just sequencing for Delta, they're sequencing for any emergent variants, which is, of course, the real benefit of having the surveillance effort in place.
How many tests are included in that random sample each week?
200.
Chloe Leshner, WCNC, has a follow-up question.
Are you all worried at all about this maybe taking away some incentive for people who haven't been vaccinated to go out and get a shot, since now, being fully vaccinated doesn't necessarily mean that you don't have to wear a mask?
We consider the fact that that's always a potential. As we move into this, we're trying to help people understand why the masking is necessary, even though you've been vaccinated, and the importance of being vaccinated in terms of your own health and your own ability to manage this virus if you were to get vaccinated. So, if you were to get infected. So we'll continue to try to help people understand why it's important to mask and vaccinate. It's not an either or, it's a both right now.
Yeah, and Gibbie said this earlier. I mean, it's important to make sure, and how this is being discussed in the public domain, that folks understand that masking is a tool to protect ourselves, but also protect us from getting other people sick. And so it's really important that folks consider it not just about their own health, but the impact they could have on someone else. And so we think it's an important tool to help us reduce the spread of COVID, but also I think we saw last year there wasn't a flu season really because we had tools in place. We had some of those mitigation measures in place, including masks, to help us in that process.
HSaenz is next.
Hey, Gibbie, a quick clarification. At the beginning, you said that there were some conversations that you're having with the county, and it sounds like the towns, but then you said that you are not thinking of a mask mandate right now, but then you followed that up with you have been emailed by the towns. So can you clarify, is a mask mandate being talked about with the towns at this time? And then also, you picked up on the variants being protected by the vaccines. How close are we until there is a variant that is not protected by these vaccinations?
So the point I was making is we were hearing from the towns, sort of wondering what we were thinking about from the public health perspective. I really don't, we haven't had specific conversations with the towns at this point, other than them seeking information from us, and which we're sharing with them. And then I do believe that, you know, the manager will likely be having conversations. You know, she's sort of the lead on that, and so we'll have to wait and see what happens with all of that. You know, at this point, a specific mask mandate has not been brought up. We've not had the opportunity to have the conversation about that. So that's sort of where we are in process right now. And your other question, Hunter?
Yeah, I know that this has been talked about for a while now with the Delta variant, but with 50% of our people vaccinated fully, I mean, how close and how real of a situation is it that we're going to have a variant that's not protected by the vaccine?
You know, and Dr. Washington can chime in on this one as well. I don't think we have any idea. What we do know is that this virus, has some characteristics that make it easy for it to mutate, and that there is a lot of it in our community. So both of those things together create concern. And all we can do is watch to see what the virus is going to do. It doesn't check in with us every week and let us know what to expect. So we continue to watch that. I know the CDC is watching that very carefully as well. And once we know something, we'll let you know.
If only it would check in with you.
Absolutely.
Yes. Hunter, it's certainly possible, and I think that's the real reality. And I think as we talk about the virus with the community, that's why we are pushing so hard for folks to continue to move beyond not getting vaccinated to getting vaccinated, and why the mask recommendation is so critical, because if we can slow the spread of the virus in the community, we will reduce its chances of mutating and a variant of consequence, developing that will pose a new threat to us as an entire community. So.
Next question is Maggie Contreras, WBTV.
Hi, Gibbie. Quick question. You mentioned the younger age group that has the lower vaccination rate. Is the county going to change up, do anything differently, or get more aggressive in the push to try and target that age group since they're not getting vaccinated as quickly as expected?
So we are constantly looking at new and better ways to get vaccine into the populations in the communities that have low vaccination rates. And we've looked at any number of venues where we can take vaccine and make it readily available and easy to access. We've been to breweries, we've been to food truck events, we've been to any number of settings. There are others that have done it at sporting events. There's a number of different ways that we're trying to get that vaccine out. So we'll continue to try to do that. The other is making sure that we're messaging through leaders in the community, others that they listen to. So we're continuing to look for ways to do that. Any recommendations, suggestions y'all might have for helping us do that, we're open to suggestions. And we're looking to our partners, our other health departments across the county, across the state, not across the county, but across the state and across the government, the nation, to see what they're doing too and where they're having successes that we might be able to implement. So yeah, it's a constant effort to look at new and different ways to make it available.
Katie Soloff has a follow-up question.
Yeah, I just was curious. Realistically, do we know how many people really qualify for having, I guess, quote unquote, legitimate reasons for not getting the COVID vaccine, like whether those are religious exemptions or medical exceptions? I keep hearing those getting cited, but I wasn't sure how many they accounted for, at least in Mecklenburg.
So we don't know yet about what's going to happen with COVID because we're just, we're implementing this starting August 2nd. But we know with our flu vaccine, roughly 6% of our staff had a religious or medical exemption last year. So we can only assume that we might see the same thing with COVID, but we'll just have to wait and see, and we'll let you know once we know.
Okay, we have time for a few more follow-up questions.
So will you be approaching the towns and the city of Charlotte before the governor's presser tomorrow about a possible mask mandate, or are you waiting to see what the governor says first before you consider any future action?
We'll not be acting before the governor's press conference tomorrow afternoon. Number one, I know that the leaders in our community are going to be interested in what the governor has to say, and rightfully so, because we've been following governor's recommendations and restrictions up to this point. So we'll not be having those conversations prior to that.
And is this another thing that you'll seek unanimous consent from all the towns and the city for?
If you'll remember, we had a point in time where the city, the county, and a couple of the towns did something, and the other towns decided to just go with the governor's order. So I don't know. We'll just have to wait and see how the discussion rolls out and what people are interested in pursuing.
Gibbie, can you talk about what types of masks people should be wearing? Is it fine to wear a cloth mask? Should they be double masking? And can you also talk about how safe should people feel right now if they only got the J&J one-shot vaccine compared to Pfizer and Moderna?
So a mask that covers your face appropriately is the best thing, right? There's different discussions out there about which masks are better. But if you're going to use a cloth mask, at least a 2 to 3 ply mask is what you're wanting to be focused on. The surgical masks, some folks are wearing N95s or KN95s now. If you'll remember, we recommended that we not do that back in the early days, but that was more about supply, and the supply is not an issue at this point. So I think in most cases it's what people are comfortable with. So we're not making specific recommendations at this point, other than making sure that that mask fits appropriately and that you're wearing it consistently.
Next question, please. Any further questions today? All right, thank you everyone for your time. We'd also like to recognize our American Sign Language interpreter for this broadcast, Richard Hafner. Thank you.
Thanks, everyone.